Thank you for the chance to share some of our research on the ongoing crises related to the COVID-19 pandemic, including, of course, the global economic slowdown and the health crisis caused by the COVID-19 virus. So the following will be a short presentation on the links between the economy and the pandemic, the health crisis. And I would like to reiterate that this is an ongoing monitoring of the situation and a stock taking of the emerging evidence and research and data on the COVID-19 pandemic. Let me begin with the main messages. First, the lockdown is useful if it buys us time to strengthen health systems and test, trace, treat systems. However, if we fail to strengthen these systems, then on again, off again lockdown becomes inevitable, and this severely damages the economy. And this is my main message for my presentation, that it is a false dichotomy to claim that we have to choose between a healthy economy or a healthy population. In fact, we can have both if we are able to build the necessary institutions and the necessary systems that could better protect us from the spread of the coronavirus. And in particular, this involves strengthening our health systems and strengthening the test, trace, treat system that will be necessary to keep the COVID 19 from spreading widely. And this, unfortunately, is where the Philippines continues to struggle. And therefore, this is why we have inevitably fallen into a pattern of on again, off again lockdown. My second message is that some of our macroeconomic fundamentals are now strained due largely to the uh, to the GDP contraction that has taken place in 2020 and the expected slow economic recovery in 2021 and 2022. So one of the indicators, of course, is that the debt to GDP ratio has increased by somewhere in the neighborhood of 12 percentage points based on initial estimates, and that credit rating agencies have now already warned that we are squandering our buffers for crisis response. So these are all, not very good signs of the economic situation right now. And a large part of this is because of the negative psychology of recovery that we are now experiencing. We lack the consumer confidence and investor confidence that we need in order to mount a more aggressive and successful economic recovery. And the main reason for this is because there is an expectation that we are continuing to fail to flatten the COVID 19 curve. And the reason for that, in turn, is because of the expected weaknesses in the test, trace, treat system and the healthcare system that continues to be challenged by the spread of the coronavirus. The third message I want to share is that weak results on test, trace, treat, and delayed rollout of vaccination, now compounded also by high vaccine hesitancy, these are all likely to lead to delayed economic recovery, which is my point earlier. And the fourth point, that millions of Filipinos are likely to slide back into poverty, and millions of children with low quality or no access to education may risk setting back an entire generation. So this is what I would argue is the unequalizing impact of crises like pandemic, which is what we have right now. Those who are able to cope will be able to continue to thrive. Those who are able to work from home, those children with access to technology, those schools with adequate training and access to technology, they will all thrive. On the other hand, the vast bulk of our public sector education system may not necessarily have these resources, may not necessarily have this training, and therefore that will actually cause lower quality access to education for the vast bulk of our children. And this will create a division between those who can cope and those who cannot. And we may actually see the after effects of this years from now, decades from now, when those same kids actually enter the labor force, and a vast majority of them have suffered from the pandemic period. So my fourth point here is that the pandemic will likely exacerbate inequality. And my last point is that it will be a challenge to build back better under bad governance. And so the economic trajectory is riding on the 2022 elections. So this is just my point on the political economy of recovery, that we really need better governance in order to mount a successful economic recovery for the country. So before I go into the details, I would just like to set out the framework for my analysis, and that is to show you the link between the pandemic and the overall goal of flattening the COVID-19 curve and the economy. So the overall goal is to actually lower the number of COVID-19 cases by containing it successfully, right? And one way to contain it is actually by applying mobility restrictions in the form of lockdown. So the goal of this effort, at least initially, is to try and buy us time so that our health systems can increase its absorptive capacity, and time so that our test, trace, treat systems can be set up so that we help mitigate the risk of an explosion of COVID-19 cases. So this containment strategy of lockdown is not supposed to be the main tool against COVID-19. It is only buying us time for the main uh, inputs that we need in order to successfully contain continuously the spread of the coronavirus, and that is the health system and the test, trace, treat system. So when you apply a lockdown, what you essentially are trying to do is to flatten the COVID-19 curve in the first instance, and you are buying yourself time to set up that health system and test, trace, treat system, so that when you move from point 1A over here, right, to point 1B, when you have successfully flattened the COVID-19 curve and lowered the number of COVID-19 cases, at least the daily number of COVID-19 cases, then you are actually setting up the situation where if you have the healthcare system and the test, trace, treat system ready at that point, you will not necessarily uh, experience another explosion of COVID-19 cases. You will be better able to contain the spread of the disease. Now, unfortunately, when you're trying to move from 1A to 1B using a lockdown method in the first instance, and this is the different phases of the disease outbreak. So the disease outbreak in phase one is when case loads are coming up, and then you have a second phase when you are applying crisis relief because you're also applying mobility restrictions, so the people are actually staying at home, not necessarily going to work. Those who can work from home can continue to earn, but those who cannot will most likely need crisis relief. And the third phase is when you have crisis recovery, when you have successfully flattened the COVID-19 curve. And it will be critical to manage the psychology of recovery to show to everyone that the health system and the test, trace, treat system are strong enough in order to mitigate any risk of an explosion of coronavirus again. And finally, the so-called new normal, what will happen to the country when you actually move into the future when COVID-19 has been successfully contained, and presumably you've successfully rolled out a mass vaccination campaign, which we are not yet there yet. So unfortunately, and that is the link down there, while you are actually applying the mobility restrictions during phase two, which is the crisis relief period, and as I mentioned, you have crisis relief because you are actually applying mobility restrictions. You will then have a contraction of the economy precisely because of the mobility restrictions, and a movement from 2A to 2B of the GDP, so a contraction. And eventually, as you are able to strengthen your systems, you hope that you will have a recovery, a V-shaped recovery, and move from 2B to 2C, right? As you are now in the crisis recovery phase and you continue to keep the curve, the coronavirus curve flat. Now, this is at least the narrative of the countries that have succeeded in containing COVID-19. And unfortunately, that has not been our narrative It has been the narrative of countries like Taiwan, of New Zealand, and even of, to some extent, countries like Vietnam, but not necessarily the narrative of the Philippines. So here's the latest data on the Philippines. Of course, it's a little dated by the time that you see this, since I pre-recorded this presentation. As of April 2021, we have over 940,000 confirmed cases of COVID-19, and we expect that there is actually an under-testing of COVID-19, so the true number may actually be a lot larger than this, with about 16,048 deaths reported to WHO. And again, there is now some discussion that this is an underestimate of the total number of deaths linked to COVID-19. And of course, you can see from the COVID-19 curve here, the actual curve, not the hypothetical curve, you will see that we've not been able to flatten the curve successfully to almost zero or some number near to zero. In fact, the best that we've been able to do is to lower it to some number bouncing around the 1,000 to 2,000 number in terms of daily cases. But we've never been able to lower it significantly beyond that. So in fact, in recent weeks, in recent months, we have experienced a large wave of COVID-19 cases, once again testing the health system and once again triggering stronger lockdown measures. And unfortunately, that just demonstrates the uh, inadequacy of our efforts to strengthen the health system and to develop a very strong and successful test, trace, treat system. So the end effect is that we have been experiencing a very, very costly lockdown. And by one estimate, it is costing us about 18 billion pesos daily. It has cost us about 26% of businesses closing. By middle of 2020, about 10 million workers expected to lose their jobs. And this is probably a lowball estimate, since this was also estimated early in the pandemic in May of 2020. And finally, statistics from social weather stations show an increase in the number of hungry families. And this, of course, indicates once again the huge development costs of uncontained spread of coronavirus in the country, our unsuccessful effort to flatten the COVID-19 curve. And of course, millions of Filipinos are expected to fall back into poverty because of this protracted coronavirus related economic slowdown. And our on again, off again lockdown has actually been punishing our economy and creating an environment where there is such a degree of uncertainty among investors and consumers that we are unable to mount a more successful and aggressive economic recovery. So there is a recent report by the World Bank that actually put the situation very succinctly. And here I will just read it. The Philippines is one of those countries that has not been able to successfully transition away from shutdowns and lockdowns to a more efficient containment strategy. The tough response has imposed a big cost on the Philippine economy without delivering a commensurate benefit in terms of containment of the disease. So this is the assessment of the World Bank, which I tend to agree with, that applying lockdowns is not necessarily the best way to contain the spread of coronavirus. It is uh, possibly acceptable in the first instance when you're still strengthening your health system, when you're still strengthening your test, trace, treat system. But when you keep on applying lockdown, that is actually going to debilitate your economy, and it will continue to demonstrate to your consumers and to your investors and to your businesses, to your economic stakeholders, that your health systems and your test, trace, treat systems are unable to contain the virus. And understandably, this will create a very negative and pessimistic economic environment. So here are some more figures, and I will not belabor the point. It is the biggest GDP contraction on a quarterly basis since 1947. We have recorded high inflation, the highest in about 22 years. The GDP to public debt ratio has actually deteriorated, and it is back to 2006 levels. It is the highest self rated hunger recorded since 2012. It is the self rated poverty set back to 2014, despite our progress in this area. And it is the highest unemployment rate since 1995 quarter four, tracking the time series on unemployment. So these are among the statistics. And for those of you interested in the data, I'm happy to share the sources of these statistics as reported by government agencies, social weather station, and other sources. And the emerging analysis from analysts in the private sector as well as in the public sector is that we will likely have a very slow recovery, a protracted recovery instead of a V-shaped recovery. And this relates again to that pessimistic and highly negative um, perception right now that we are unable to strengthen the very same systems that we need to keep coronavirus contained and to once again um, produce the confidence that we can go out there, set up our businesses, go back to work, send our children back to school without the fear that the coronavirus will again explode and become difficult to contain. So that degree of confidence which other countries have been able to achieve is not necessarily what we have managed to achieve here in the Philippines. So here are some more analyses. This one is from Fitch Ratings. New lockdowns may further erode the Philippines' rating buffers, and this again signals that many analysts expect us to go back to lockdown because of our repeated inability to strengthen the health system. A think tank warns of bleak Philippine economy because of the leadership vacuum. And finally, Moody's has already forecasted a risk of credit rating erosion due to the delayed recovery. And here's a point I wanted to emphasize before I end my presentation. And amidst all of the economic contraction and slow economic recovery situation, we are actually seeing a potential for an increase in inequality in the country because of the pandemic. And here I would just like to go back to the quote of Damien Barr, who is observing the impact of the coronavirus pandemic on various countries. And he said here very, very succinctly, we are not all in the same boat. We are all in the same storm. Some are in super yachts, some have just the one oar. And I think this very nicely captures the situation of the dire situation of many Filipinos compared to those who are better able to cope, those who do have the resources, the technology, who can work from home, whose kids can actually learn from online, who go to schools with the same resources. That is not necessarily the case for the vast majority of our children who do not have access to those resources, those technologies, and who will be who risk being further left behind because of the pandemic. So this is a very high price we're going to pay well into the future, not just the immediate economic crunch, but the unequalizing impact on the capabilities of our young people. This entire cohort right now that is suffering from the lack of investments in education and possibly also in health, which will be carried well into the future. So this is something to monitor and certainly something to actually try to address if we are to mitigate not just poverty but also inequality moving into the future. And again, I'm just going to point out here a dire prediction that about 3 million students were still unenrolled by September of 2020, and the possibility that a lost generation, a large number of Filipino children who may have delayed education or may actually drop out of school altogether. And there's a lot of research from previous crises, financial crisis, economic crisis, and even health crises. The children that drop out of school may not necessarily go back to school. So there's a big risk that the crisis will produce a highly unequalizing effect on generation of the country's children. And here I just want to end with a few ideas on what to do and what to build on in order to strengthen our response to the COVID-19 pandemic. And this is not necessarily novel. We just have to look to some of the successful countries that have been able to contain the spread of COVID-19. And here I would like to mention Thailand, which has a strong record of health campaigns with public private partnerships, so that going into the COVID 19 pandemic, Thailand was able to draw on a long history of working with the private sector in order to strengthen cooperation in their COVID 19 response. And here they have also demonstrated strong uh, capability to mount public health campaigns so that they are able to immediately um, collect the efforts of the entire nation in terms of changing behavior, in terms of protecting each other and their families from the spread of the disease. And so this is the kind of social cohesion that many countries already had going into the COVID-19 pandemic, and something that we should necessarily think of in terms of strengthening for our own future efforts to build back better. Here's another country, Vietnam, that has actually implemented a strong strategy to collect information from citizens who are voluntarily submitting this information to a government created app called nCoV. So this allows the public sector in Vietnam to collect all of this information and to inform their coronavirus response with the right data and the right information, so that they are able to mount a more successful counter coronavirus response. And they're able to do this because they have been building a lot of transparency in their health sector and their policies in that sector, and they have been building a lot of trust among their citizens, so that they voluntarily shared a lot of this information. And then, of course, there is South Korea, which many consider to be the gold standard of, responding to the coronavirus. And the interesting thing about South Korea is that it actually strengthened its health systems based on earlier failures, the failure in terms of containing SARS and the failure in terms of containing MERS, which are earlier um, diseases that have actually affected South Korea. And it has learned successfully from these early challenges. And now it has a health system that is able to rapidly ramp up and actually increase its absorptive capacity to better meet the challenges of the COVID-19 pandemic. It also has a strong test, trace, and treat system that builds on a strong network of laboratories that it managed to keep based on earlier threats of disease spreading in that country. And as I mentioned, MERS and SARS. So they have been able to keep that latent capability in their health system and build a surge capability in their health system just in case a pandemic actually affects them again. And all of those investments are now serving South Korea in good stead. And they are one of the countries that have been able to quickly and decisively contain the spread of coronavirus. So let me end my brief presentation with these thoughts on what are the components, possible components of an inclusive recovery. First of all, I think technology for rapid testing, apps for tracking, real-time information sharing, and a ramping up of the application of telemedicine. These are all parts of the future, and they should have been parts of the present if we were able to successfully invest in these areas. Then we would have been able to more effectively beat back coronavirus. And these are, of course, suggestions in terms of strengthening our capabilities in these areas immediately in order to start turning this thing around. Second is trust for compliance with quarantine and willingness to share information. This is giving up our personal privacy for the common good, combined with strong social cohesion and no discrimination. So these are things we need to build in the Philippines over time. This doesn't necessarily pop up immediately. And this runs counter to some of the messaging that we have been hearing from various parts of government so far, which have not necessarily been, productive and may not necessarily have helped the situation. The messaging that blames people for being pasaway, the messaging that actually applies too much of a punitive approach on a health crisis, which tends to divide communities even more rather than unite communities around the government response. So these are some of the areas where we need to continue to improve. And finally, we need to transform the brick and mortar health system to build the search component and emphasize inclusion. So there's a lot of learning and a lot of lessons that we need to absorb from the past year and change from the pandemic experience. And certainly our health system has not necessarily been able to align quickly enough or in an agile way enough to improve its absorptive capacity. And to the extent that we are able to strengthen it, including the health insurance system reform that is necessary in order to plug leakages, to improve the governance of that system. We need to consider all of these reforms in order to build back better and successfully apply the lessons, painful lessons at that we've learned from the COVID-19 pandemic. So I will leave it here, and I thank you very much for the chance to share these ideas with you today.